So good morning, Stuart. Again,
Good morning.
Thank you. So again, this video is a kind of educational video about other patients that might have your same chronic pain condition, and just kind of talk to them about what we're able to do for you here at the Washington Pain Center and or spinal stimulation. So let me set the table. So you came to me how long ago?
About 3 months ago.
3 months. And again, you've had chronic abdominal pain for how long?
Yes. Really, since my early 20s, I've had irritable bowel syndrome.
And round figures, how old are you now?
I'm 53.
Okay, so about 25 years
Yes.
at least. Okay.
Yes.
And obviously with IBS, you've went to the GI, people, and you've had, treatments, and you still have the chronic abdominal pain.
Yeah, I mean, I really researched it through the years, and I tried everything. Western and Eastern medicine.
And
like
actually, you actually did a lot of work with NIH and things like that as a researcher.
Yes, right. I'm very familiar with the technology because that's part of what I do for a living.
Right. So we actually started 3 months ago this conversation about spinal stimulation for people with chronic pain that nothing else has worked.
Exactly.
And we just did the trial, and you had it implanted. You had the trial placed for a couple of days, like a week or a little bit more than a week.
That's right.
So how did you find the experience?
It was dramatic. I mean, as soon as I left the day of the implant, when it was turned on, I started to monitor carefully, because I'm looking for an absence of symptoms. And each day I did have about one episode of moderate IBS pain. It would last 15 to 20 minutes, and then that was that. And by the end of the week, counting up those episodes, I mean, in a typical day, I would have 10 or 15 of those episodes, and they would often last for, sometimes 2 or 3 hours. So it was a dramatic difference. I was impressed. I didn't know spinal cord stimulation can work for visceral abdominal pain, and every indication is that this is a big success for me, and I'm still getting used to this idea that pain won't be there anymore.
And the stimulation, obviously, outside the absence of pain, did it feel like anything to you?
No, you don't feel anything. In fact, I could go up and down a little bit on the stimulator, and 7 was my number. 8 I would use when I would get that, episode.
But the stimulation wasn't uncomfortable.
No, and then when I went to 9, I would feel a little bit of pressure, so I knew exactly where my sweet spot was, and during the day when I had it set at 7 or 8, I never felt anything.
Oh, how about that? Now, overall, so percent better for this 25 years of pain was how much?
I mean, right now it's 1 week, and I can very honestly say it's at least 80% benefit. It's probably going to be more.
Right. And in terms of in the past, did you ever try opiates or things like that, or did you ever not start that?
I never got as far as opiates,
right.
But I tried everything else.
Right.
And I'm really glad I'm here seeing you as a pain specialist. I was hoping it wasn't going to go to opiates, so this is a breakthrough for me.
Right. So people, if you're, in closing, if people had chronic belly pain, what would you tell them?
I would
given
tell
your experience.
them, right now, today, I finished the 1 week trial. I didn't get a permanent implant yet. I'm going to, but the trial period was not very traumatic, and if you have complaining of years and years of pain, you certainly should try this. As a life science specialist, I know the proposed mechanism of action, and it really makes sense. This is really about science, right, and physiology.
Excellent. Well, thanks for your time. I appreciate it.
Okay.